exactly where it goes and what's happening to it whilst it's there. And we fill the balloon with water, anywhere between about 5 to 700 ml of water, to take up place in your stomach. So when it takes up place in your stomach, what we find is that there's less place for food to go, you generally eat less, and also it delays gastric emptying. So it delays the passage of food past the stomach, and therefore you feel fuller for longer and has an overall effect of eating less. So that's merely an adjunct that we use nowadays in terms of getting you to lose some weight. And as I said, it's a non-surgical procedure and it's done on an outpatient basis. So essentially, come in the morning, have a little bit of sedation, have the scope down, have the balloon put in, and you leave soon thereafter. Generally stays in for about 6 months.
And has this been safe?
Yeah, certainly. I think the overall safety has been proven internationally. There's over 350,000 balloons that have been placed. Like many things in life, you have options, and the balloon is no exception. We use the market leader in intragastric balloons that we have available here in Durban, right on our doorstep. And certainly in the last 2 years, with all the balloons I've put, we've not had any issues thus far.
So what is this balloon actually made of?
It's made of a very strong substance, almost like latex, and it's the stomach is a very hostile place. It's filled with acid, and it usually has it's made of a substance that will be able to withstand the hostile environment of the stomach. So people always ask me about whether the balloon can rupture, etc. Yeah, certainly it can, but it's not like how a party balloon would. What we refer to as rupture means just for fluid to start leaking out and the balloon gradually collapses. When we fill the balloon with some water, we put some dye into it. So usually what happens is that if you have an episode of balloon rupture, the fluid with the dye leaks out and it discolors your urine, and that generally tells us that the balloon has malfunctioned. But as I mentioned, we use a very good balloon, and in none of the patients so far have we had anything go wrong with the balloon.
So you said anybody can actually have this done?
Yeah, anybody can. I think if you have an intact stomach and you hadn't had previous operations on the stomach and you're not pregnant at the moment, generally speaking, we do a risk assessment before we put the balloon in. Because of the reversible nature and the outpatient basis of the balloon, most people will qualify for an intragastric balloon insertion.
And is this covered by medical aid?
It's not covered by medical aid, unfortunately. At the moment, it's purely on a cash basis.
Mm-hmm. Okay. So we're going to quickly just take a WhatsApp message. It's actually Renee. Renee says, and she's from Renee Pillay from Arena Park. And she says, good evening, Shona, and to the doc. Hope you all are well. Actually, she wanted to know what were the symptoms of gallbladder, gallstones, and what causes it, and how you can prevent it from forming. Renee, I hope you caught that. Doctor had answered those questions. Holding on patiently is Mrs. Govender. We'll say good evening, Mrs. Govender. Hi.
Hi, Shona. How are you?
Good, thank you, Mrs. Govender. Hope you're well.